Welcome to POC Nurse. Let's do a CCRN question. Question: A 55-year-old male with a history of obesity and smoking is admitted to the ICU with severe pneumonia. He develops acute respiratory distress, hypoxia, and bilateral infiltrates on chest x-ray. The patient has no recent history of blood transfusion. What is the most likely diagnosis? The answers are A. Acute respiratory distress syndrome, B. Transfusion related acute lung injury, C. Pneumonia induced pulmonary edema, and D. Transfusion associated circulatory overload. And the answer is A. Acute respiratory distress syndrome. Why is this the answer? ARDS, that's acute respiratory distress syndrome, is characterized by acute respiratory distress and bilateral infiltrates in the setting of an underlying condition, like pneumonia in this case. The key feature distinguishing ARDS from TRALI, that is the absence of a recent transfusion and the more common association with other risk factors such as infection, trauma, or aspiration. So here, this patient hasn't received any blood recently. So therefore, from the choices we're giving, ARDS will be the most correct answer because this patient is in respiratory distress, has bilateral infiltrates on the chest X-ray in the setting of an underlying condition such as pneumonia. B. Transfusion-related acute lung injury is incorrect because obviously it has to occur within 6 hours of a blood transfusion, and this patient hasn't received any blood transfusion. TRALI is also associated with the immune response triggered by the transfused blood, not by infection or other factors such as pneumonia. The answer C is incorrect. Pneumonia-induced pulmonary edema. While pneumonia can cause pulmonary edema and respiratory distress, this option does not fully explain the bilateral infiltrates seen on chest X-ray, which would be more indicative of ARDS. The answer D, transfusion-associated circulatory overload, is also incorrect. TACO, that's transfusion-associated circulatory overload, is caused by fluid volume overload during a transfusion, which typically leads to signs of heart failure like cardiomegaly and pulmonary edema with normal lung functions prior to the transfusion. No recent transfusion occurs in this question. Thank you for watching. Please like, share, and subscribe, and I will see you in the next video. Bye bye now.